Hello everyone, now let us discuss about 2023 ICD-10 coding guidelines for chapter 5, which is nothing but mental, behavior and neurodevelopment disorders. Now, in the chapter 5, we have 4 guidelines. Pain disorders related to psychological factors, mental and behavioral disorders due to psychoactive substance use, factitious disease, and there is a new addition in 2023, that is dementia codes. Dementia codes have been revised. Now coming to pain disorders related to psychological factors. There are two codes in this scenario, F45.41 and F45.42. You need to assign code F45.41 for pain that is exclusively related to psychological disorders. And you should not code codes from category G89 along with F45.41. Because under G89 you can find excludes one note which includes F45.41. So F45.41 and G89 should not be coded together. Now coming to F45.42, pain disorders with related psychological factors should be used with the code from the category G89. Under this F45.42 you can see codes from category acute pain or chronic pain. If there is documentation of physiological component of a patient with acute or chronic pain. Whenever there is documentation of either acute or chronic pain, along with F45.42 you can use acute and chronic pain codes. But you should not use acute and chronic code pains with F45.41. That is the only difference. Now let us see an example. If you see the description of F45.41, it indicates pain that is exclusively related to psychological disorders. The other synonyms are chronic psychogenic pain, delusional pain, psychalgia, psychogenic backache, psychogenic headache, psychosomatic abdominal pain, somatoform pain disorders. These are some of the related terms. If the physician documents any of these terms, then you need to code F45.41. And the note is we should not code from the category G89 along with F45.41. Let us see an example. Patient presents with chronic psychogenic pain. Here, for psychogenic pain, you can see here chronic psychogenic pain is a synonym. So you can code F45.41. But additionally, you should not use chronic pain code because they should not be coded together. Now next F45.42. Under this you can also see code also associated acute or chronic pain. And the description of F45.42 is pain disorder with related psychological factors. Some of the synonyms are difficulty coping with pain, health management deficit, pain disorder with psychological factor, pain self-management deficit acute, pain self-management deficit chronic, and psychosocial dysfunction due to chronic pain. Now let us see an example. Patient presents for pain management. Reason for visit is psychosocial dysfunction due to chronic pain. Here you need to code F45.42. That is pain disorder with related psychological factors. Followed by G8929 for other chronic pain. Coming to next guideline, mental and behavior disorders due to psychoactive substance use. This is again subcategorized into in remission codes, psychoactive substance use, abuse and dependence, guidelines regarding psychoactive substance use unspecified, medical condition due to psychoactive substance use, abuse and dependence, blood alcohol level. Now, mental and behavior disorders due to psychoactive substance use. Coming to in remission codes. Selection of codes describing in remission from category F10 to F19. Mental and behavior disorders due to psychoactive substance use. Requires the provider's clinical judgment and are assigned only on the basis of provider documentation. So, provider must clearly document in remission. Then only you need to code in remission codes, because there are specific codes for in remission and there should be a clear documentation by provider. Mild substance use disorders in early or sustained remission are classified to appropriate codes. For the substance abuse in remission, moderate or severe use substance disorders in early or sustained remission. If you see any of the category, tabular list of from F10 to F19, you can find different codes. For in remission, sustained remission, early or sustained remission, and there should be a clear documentation by the provider in order to code the specific code. Now let us see some of the examples. The first is patient presents with opioid use in remission. Here the physician clearly documents in remission. So the appropriate code is F11.91, opioid use unspecified in remission. Next example is opioid patient presents with cannabis use in remission. So the appropriate code here is F12.91, cannabis use unspecified in remission. So there must be clear documentation of remission in the medical record by the provider in order to code those specific codes. Coming to psychoactive substance use, abuse and dependence. There are different codes for use, abuse and dependence. When the provider documentation refers to use, abuse or dependence of the same substance, for example alcohol, opioid or cannabis, only one code should be assigned to identify the pattern of use based upon the following hierarchy. There are specific codes for use, abuse and dependence. And whenever the physician documents use, abuse and dependence of the same substance, the code assessment should be based on the pattern in the following hierarchy. If both use and abuse are documented, assign only abuse. If both abuse and dependence are documented, assign only code for dependence. If use, abuse and dependence are documented, assign only the code for dependence. If both use and dependence are documented, assign only the code for dependence. So these rules must be taken into consideration. Let us see an example. Better understanding the order of severity is use followed by abuse and finally dependence. Use will become into abuse, abuse will become into dependence. So you need to code the highest sequence among them. Whenever use and abuse are documented, you need to code abuse only. Whenever abuse and dependence are documented, you need to code dependence only. Whenever use, abuse and dependence is documented, you need to code dependence only. Dependence is the highest. So let us see a scenario. Patient presents with cannabis use. So the code is F12.90. Cannabis use unspecified, uncomplicated. Second case, patient presents with cannabis use and abuse. Here abuse is more complicated than use. So you need to code abuse. F12.10. Cannabis abuse uncomplicated. Next, patient presents with cannabis use and dependence. Dependence is more severe than abuse. So the appropriate code is F12.20. Cannabis dependence uncomplicated. And finally, patient presents with cannabis use, abuse and dependence. Here also you need to code the highest thing, that is dependence. F12.20. Cannabis dependence uncomplicated. So the order is use followed by abuse and finally abuse will turn into dependence. Coming to psychoactive substance use unspecified. It is given by fourth digit 9 from F10 to F19 series. You can see F10.9, F11.9 and so on till 19. It is given by the fourth digit 9 and the codes are further expandable. Like all other unspecified diagnosis codes, the codes of unspecified psychoactive substance use should be only assigned based upon the provider's documentation and when they meet the definition of reportable diagnosis. And these codes are to be used only when psychoactive substance use is associated with a substance related disorder. For example, sexual dysfunction, sleep disorder, or mental or behavioral disorder, or if it is associated with a medical condition and such a relationship is documented by the provider. Now, coming to coding of medical conditions due to psychoactive substance use, abuse and dependence. Medical conditions due to substance use or abuse and dependence are not classified as substance-induced disorders. Medical conditions are different and substance-induced disorders are different. Substance-induced disorders means they occur due to that particular psychoactive substance. But medical condition is different. Assign the diagnosis code for medical condition as directed by the alphabetic index along with the appropriate psychoactive substance use, abuse or dependence code. Let us see an example. For example, for alcoholic pancreatitis, this is a medical condition. Pancreatitis is a medical condition. For alcoholic pancreatitis due to alcohol dependence, assign the appropriate code from the category K85.2, alcohol-induced acute pancreatitis, and the appropriate code from F10.20, alcohol dependence uncomplicated. And it would not be appropriate or it would be inappropriate to assign code F10.288, that is alcohol dependence with other alcohol induced disorder, because here pancreatitis it may occur due to alcohol use, but it is not alcohol induced. This is a medical condition that must be coded with specific diagnostic code that it has been assigned by the alphabetic index. And you should not code F10.288, alcohol dependence with other alcohol induced disorder. You need to code F10.200 in this particular example. And in order to code F10.288, physician must clearly document that that particular disorder is alcohol-induced disorder. Then you can use F10.288, but not for this case. Now coming to blood alcohol level. A code from the category Y90, evidence of alcohol involvement determined by blood alcohol level, may be assigned when this information is documented and the patient provider has documented a condition classifiable to category F10, alcohol related disorders. And the blood alcohol levels need not be documented by patient's provider in order to be coded. They can be coded simply based upon the lab results. Specific diagnostic statement is not necessary. See an example. A patient presents to ER with hallucinations and has been talking to himself. Patient appeared confused and agitated. When past medical history of the patient record indicated that alcohol dependence with alcohol-induced psychotic disorder with hallucinations. The past medical history of patient record indicated he has been suffering with alcohol-induced psychotic disorder with hallucination. When asked whether he is sober, patient indicated that he has been drinking since morning, though he is not sure when exactly. Samples were sent for alcohol levels and the patient was found to have blood alcohol level of 40 to 50 ml per 100 ml. So here first you need to code F10.251, alcohol dependence with alcohol induced psychotic disorder with hallucinations, followed by Y90.2, blood alcohol levels of 40 to 50 ml per 100 ml. Now coming to factitious disorder. Factitious disorder imposed on self or Munchausen syndrome is a disorder in which a person falsely reports or causes his or her own physical or psychological signs or symptoms. That is, patient might not be having those symptoms in real, but he is assumed. And for patients with documented factitious disorder on self, you need to assign the appropriate code from category F68.1, factitious disorder imposed on self. The second case is MSBP, Munchausen syndrome by proxy, is a disorder in which a caregiver, who is the perpetrator, falsely reports or causes an illness or injury in another person, that is the victim, under his or her care, such as child, an elderly adult, or a person who has disability. This condition is also referred to as factitious disorder imposed on other or factitious disorder by proxy. And the perpetrator here, MSBP, should be given to the perpetrator, not the victim who receives the diagnosis. Assign code F68.A, factitious disorder imposed on other, to the perpetrator's record, and for the victim of the patient suffering from MSBP, assign the appropriate codes from the category T74, adult and child abuse, neglect and other malnutrition confirmed, or T76, adult and child abuse, neglect or other maltreatment suspected. Victim should be given the codes T74 or 76, and the perpetrator should be given F68.8. Coming to factitious disorder, here you can see clearly. For self, you need to assign F68.10. Factitious disorder imposed on self, unspecified. There are other codes also, depending upon the documentation. And for factitious disorder imposed on another, or MSBP, factitious disorder by proxy, or Munchausen syndrome by proxy. MSBP indicates that. For that, F68.A is the appropriate code, and that must be given to the perpetrator record, not the victim record. F68.A indicates factitious disorder imposed on other. If it is on self, you need to code F68.10. If it is imposed on another person, you need to code F68.A. Coming to the new addition, dementia codes. They are the new addition of 2020. The ICD-10-CM classifies dementia, which are under the category F01, F02 and F03 on the basis of etiology and severity. These are the new codes: unspecified, mild, moderate and severe. Selection of the appropriate severity level requires the provider's clinical judgment, and code should be assigned on the basis of provider's documentation. Provider must clearly specify the severity level, whether it is unspecified, mild or moderate. Then only you can code the appropriate code. If the documentation does not provide information about the severity of dementia, assign the appropriate code for unspecified severity. That is one rule. If the documentation does not provide information about the severity of dementia, assign the appropriate code from unspecified severity. Second case is if a patient is admitted to an inpatient acute care hospital or other inpatient facility setting with dementia at one level and it progresses to a higher severity level, then assign one code for the highest severity level reported during the stay. If he admits with one stage of severity and it progresses to another stage, for example, if he gets admitted with mild dementia and it progresses to moderate, then you need to code moderate dementia only. You need to code the highest severity level. It must be reported during the stay. The new addition of dementia codes is the severity levels: unspecified, mild, moderate and severe. They have been newly added and there are several codes indicating the specific severity level. Here are some of the examples of newly added codes. F03.90 indicates unspecified dementia, unspecified severity, without behavioral, psychological, mood or anxiety disorders. Next is F03.911. Unspecified dementia, unspecified severity with verbal or physical behaviors such as profanity, shouting, threatening, anger, aggression, combativeness or violence. Next is F03.918. Unspecified dementia, unspecified severity with behavioral disturbances such as sleep disturbance, social inhibition or sexual disinhibition. Next is F03.92, unspecified dementia, unspecified severity with psychotic disturbances. Next is F03.93, unspecified dementia, unspecified severity with mood disturbances such as depression, apathy, etc. Patient presents with dementia and patient states that he is having sleep disturbances. Here, the severity level of dementia is not specified. So, you need to quote unspecified severity. And patient is having sleep disturbances. So, the appropriate code is F03.918, unspecified dementia, unspecified severity with behavioral disturbances. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.